Today, I'm talking about what you need to know about opioids during the coronavirus epidemic. I'm Dr. Ammon Hills. I'm a pain management doctor practicing in northern Utah. Chances are you or someone you know is using opioids to treat their chronic pain or acute pain. Opioids are one of the most commonly prescribed medications in the United States, although a lot of the focus right now is on the coronavirus. We can't forget that there's another epidemic going on right now. So today we're talking about what you really need to know about opioids. The US Department of Health and Human Services officially declared an opioid epidemic in 2017. The extent may surprise you, and so we're gonna share some of the current facts about the opioid epidemic and how it compares to the coronavirus that we're dealing with right now. In 2018, there was 10.3 million people who misused prescription opioids. There was over 130 people every day who's dying from opioid-related drug overdoses. 2 million people had an opioid use disorder. So this is something that's really prevalent and greatly affecting our country. Over 81,000 people have used heroin for the first time since this opioid epidemic. To give more perspective on that, 808,000 people used heroin in 2018, and 32,656 deaths attributed to overdosing on synthetic opioids like fentanyl. The point is that opioids is a major problem that is still affecting a lot of Americans, a lot of US citizens right now. And especially now that a lot of people are quarantined, there's stay-at-home orders and in isolation. And so that's not really helping the opioid crisis at this time. There are updated guidelines recently published in the Journal of Pain Medicine that help us know how to safely use opioids. So a lot of known risks of opioids. We know there's a risk of addiction, a risk of abuse, the risk of respiratory depression, either intentional or unintentional. But with the coronavirus, we're starting to learn more or hear more about some of these lesser known side effects of opioids. One of them including immunosuppression or immune system suppression. What does that mean? That's just when your immune system gets suppressed. Your immune system is what helps you fight infections. There are certain medications, certain diseases, certain things that can cause your immune system to be suppressed, putting you at a theoretical higher risk of getting like an infection, right? There are certain opioids that may lower the immune system. And so some of those include morphine, codeine, and fentanyl. However, it's important to take into account how long a patient has been on a certain medication. If they just recently started on this medication, then more likely they're experiencing that effect of their immune system being a little bit suppressed. Whereas it may be different for someone who's been on that medication for long term. So what does this mean for you? Have you been taking opioids for a long time? It's probably not a good idea to wean off of those. One reason is because we know that pain itself, when it's not controlled, can also lower the immune system. So in those circumstances, giving opioids could potentially enhance your immune system or ability to fight off infection because your pain's better controlled. How often should you meet with your provider? Recently, they lifted the restrictions that were able to prescribe opioids via telemedicine or telehealth video visits. So that way we can help decrease the risk of potential exposure for some patients coming into the office. This is new pain that you're having and we're starting a prescription of opioids. It's recommended that if you're just not getting better, if this prescription goes beyond 1 to 2 weeks, that we do an in-office visit. So then we can really figure out what's going on, do a physical exam, see if there's any other treatments that could be done instead of opioids that are less risky to help treat your pain. These are all discussions that you should be having with your provider who's giving you these medications so that you can have the best treatment plan possible. Another important thing to keep in mind is the mental side of pain management. So a lot of people in chronic pain also have psychological factors that are in play. What could those be? So stress, depression, anxiety, sleep. All these things can exacerbate pain symptoms. If you have more stress, more anxiety, then that may increase cravings for certain people to take more opioids than they should, leading to misuse or abuse. So it's important during these times to also make sure, for me as a provider, to make sure my patients aren't overusing their medications either intentionally or unintentionally because of these psychological factors. So really the goal is to really help control people's pain enough where they can have the lowest risk possible at getting the coronavirus, getting infected, and also just being able to maintain their quality of life. So if you have any question about opioids during this time, the coronavirus pandemic, please leave those below. If you want to check out any more medical videos, you can check out this one right here. Don't forget to subscribe, and I'll see you guys next time.